Hey guys, welcome back to my channel Medical Minion, and this is the video for anatomy, so let's get started. In this video we'll discuss the definition and how and why we study anatomy, subdivision as well as the history of anatomy. So first is definition. As you all know, anatomy is the study of structures. So obviously human anatomy is the study of structures of human body. Putting it in a proper definition, anatomy is the science which deals with the structures of body from macroscopic to the microscopic level. Anatomy was derived from a Greek word called anatome, splitting this word into two, ana meaning up or apart and tome meaning cutting. So anatome meaning is to cutting up and observing the parts. So how we study anatomy? Human anatomy has for long been studying through the dissection of cadavers, which served as the basis for understanding the structures and function of human body. Cadavers are preserved dead bodies. Due to the advancement in technology, anatomy is studied in all possible ways using techniques like imagining and microscopy. Now let's look why we study anatomy. Firstly, studying anatomy will give you an insight into the complex nature of human body and the different systems that makes up the human body. The second reason is anatomy provides the base for physiology. When I'm saying this, I'm saying that anatomy provides the informations about structures and location as well as organization of different parts of the body, which is truly needed to understand physiology. Together, anatomy and physiology explain the structure and function of different components of human body to describe what it is, that is anatomy, and how it works, that is physiology. The third and important reason is the understanding of structural organization of human body is so essential that the doctor should know which structure is being affected in a disease or which structure is to be examined and what structure needed to be operated during an operation. So basically human anatomy is a practical applied science that provides firm foundation for the practice of medicine, and this practice of medicine was called as art of healing. Now let's study the subdivision of anatomy. In past, anatomy was mainly studied by dissection, but nowadays it is studied in all possible ways and techniques like imagining and microscopy. So different approaches has been adopted due to the advancement in technology. So because of this many reasons, there is a vast field of study and sub-branches of anatomy. Broadly, anatomy can be subdivided into macroscopic anatomy, meaning structures can be seen by naked eyes. Second is microscopic anatomy. Structures cannot be seen by naked eyes. We need specialized structures like microscope to see through. The third is developmental anatomy. And the fourth is specialized branches of anatomy. In turn, macroscopic anatomy has several subdivisions. The first is regional anatomy. The second is systemic anatomy. The third is surface anatomy. Macroscopic anatomy are structures seen by naked eyes, and microscopic anatomy is called as gross anatomy. Now let's study regional anatomy in depth. All the structure in particular region of the body are studied at the same time. Conventionally, the body is divided into 6 regions, namely, the first is head and neck, second is brain, third is thorax, fourth is abdomen, fifth is upper limb, and sixth is lower limb. The body is dissected region-wise since regional anatomy deals with several systems located in particular region of body. This approach of anatomy is mostly used to the clinicals, particularly the surgeon who need to concern mostly on a limited region during surgery. Therefore, this approach of studying anatomy is preferred. The second is systemic anatomy. In this, all the structure forming a particular system are studied together at the same time. A system consists of relatable organs which have common functions. So here are the various systems of body. I would like to point out some. The first would integumentary system, where we study of skin and its appendages. Second may be skeletal system where we study of bones. And the third may be muscular system where we study of muscles. And there are various different systems as shown in the image. Now let's study surface anatomy. Study of the relationship of deeper structure with the skin surface, where some of these structures can be seen while other structure cannot be seen but can be palpated on the body's surface. Palpation is an assessment technique that uses sense of touch to assess parts of body. This structure are sometimes used as anatomical landmark for surface marking of much deeper structure with help of skin pencil. The main aim of surface anatomy is visualization of structure that lie beneath the skin. It can be learned on cadaver as well as living subject. Surface anatomy provides the basis for physical examination, and the knowledge is of para importance for surgical operations. Now let's study microscopic anatomy, that is structure using microscope. This type of anatomy provides structural detail of tissues and cells. The first subpart is cytology, where we study of cells, and the second is histology, where we study of tissues. The third is developmental anatomy. Developmental anatomy is also known as embryology. This branch deals with the study of embryo from single cell stage to development of a complete human being. Now let's study specialized branches of anatomy. This group includes number of different branches like comparative anatomy, clinical anatomy, radiological, physical, genetic, and living anatomy. There are various different branches here. If you know some, then do comment and let us know. Now let's study the history of anatomy, that is contribution from the past. The first in the list is Minion, around 3400 BC, first wrote anatomical manual. Next is Shushruta, about 1000 BC, contributed in recording weight of tongue and length of intestine. The next is Hippocrates. From 460 to 377 BC, he proclaimed the famous theory of body organization called as humoral theory. According to his theory, four humor form the physiological and pathological basis of health and disease. That is blood with liver, flame with lung, yellow bile with gallbladder, and black bile with spleen. A healthy person was thought to have balance of these four humors. He is also memorized in Hippocratic oath during the time of graduation of medical students. He is also known as father of medicine for his work, and he also believed that diseases is of natural cause rather than displeasure of gods. Next is Aristotle. From 386 to 322 BC, he was a comparative anatomist. He was the first to record illustration of anatomy. He wrote the first ever account of embryology, in which he described the development of heart in embryo. He named aorta as well as he differentiated the arteries and the vein, and he is also the one to coin the term anatomy. The next is Herophilus, period 325 BC, remarkable work on nervous system. He also recognized brain as the center of nervous system as well as site of intelligence. Herophilus is also known as father of anatomy as well as was first to dissect human body. Coming up next is Galen, AD 130 to 201. He is the most influential writer of all times on medical subject involving anatomy. Coming up next is Leonardo da Vinci, the same guy famous for his art Mona Lisa. He drew outstanding anatomical sketches and made wax cast of ventricles of brain. Next is Vesalius. He is the father of modern anatomy as well as known as the reformer of anatomy. He performed human dissection and initiated
use of live model to determine surface landmark of internal structures. He also wrote the famous book De Humani Corporis Fabrica, which explained working of human body. He also strongly refuted misconception of Callan. Next is William Harville. He was the guy who demonstrated the motion of blood in heart and vessels. Next is Leeuwenhoek. He improved microscope and described cells and tissues. The next is Malpighi. He propounded microscopic anatomy during 1628 to 1694 and displayed fine details of body tissue. He is known as father of histology and his name is associated with Malpighian corpuscles of kidney as well as Malpighian body of spleen. Next is Robert Hooke. He is the guy who termed cell. Next is Schleiden and Schwann. They are the one to formulate the cell theory during the time course of 1838 to 1839. Next is Mendel, who is known as father of genetics. Next is Rankin, who discovered X-ray accidentally while performing cathode rays experiment. 16 is Henry Gray. You all know him. He is the famous writer of the most famous book for anatomy, that is Gray's Anatomy. The next is Watson and Crick. They are the one to discover structure of DNA. So while it is so important to remember the history and the contribution of anatomical studies, because according to René Dobos, his famous saying, the past is not dead history, it is living material out of which a man builds for its future. It's so true because this basic small things during last days help us to build what anatomy today is known for. So thank you for watching. If you like the video, subscribe to my channel and do follow me on Instagram where I upload short tricks and notes. Thank you.